Hong Kong's fifth COVID wave has claimed the lives of 145 people so far. Another 32 deaths were reported today, with new COVID cases at over 6,000. Maisie Mock reports.
COVID infections in Hong Kong remained high with 6,211 cases recorded today. Although the number is sharply down from 7,500 yesterday, thousands of cases have yet to be confirmed. Another 32 deaths were recorded, taking the death toll in the fifth wave to 145 so far. The latest fatalities ranged between 45 and 103 years old. Most of the fatalities were unvaccinated, elderly people with long-term illnesses. The head of the communicable disease branch, Chuang Shuk-Kwan, stressed that the virus is spreading very fast. There were over 8,000 notifications of infected cases yesterday, a 64-fold surge from 126 at the beginning of this month. Chuang said the number of notifications reflect the situation better than preliminary positive figures.
Recently, because of the huge amounts of samples, both from the private laboratory and also to be confirmed by our laboratory, there is some delay in sending those specimens and also in confirmation of those specimens. So those preliminary positive numbers are those cumulative numbers that have not yet been confirmed. We think that in order to look at the recent trend, the daily trend, we need to have another figure that can reflect the latest situation. So we use a daily number of notification to us.
There is ongoing concern about residential care homes, with over 300 of them having detected COVID among staff and residents. Meanwhile, health officials have welcomed the offer by St. Paul's Hospital to provide 20 beds for the non-COVID patients and urge more private hospitals to follow suit. Maisie Mock, HKIBC.
A health expert has urged the government to allocate more resources to boost the vaccination rate among the elderly.
I think the one thing that we could still really double down on that could make a really big difference in the coming weeks is vaccinating our elderly. We have broken ground on new facilities to build 10,000 beds. We have somehow found 400 taxi drivers who are going to be shuttling COVID positive patients to healthcare facilities. We've seen none of this to try to dramatically increase vaccination rates.